MRSA and MSSA, combating the rise of antibiotic resistance. Staphylococcus aureus, also known as S. aureus, is a common bacterium that lives on the human skin and mucous membranes. Although part of normal skin flora, the bacterium can cause serious health conditions and is easily contagious through direct contact. S. aureus infection affects many parts of the human body, including the skin, lungs, and blood. Symptoms of S. aureus infection depends on which part of the body is infected. Common symptoms include boils, abscesses, pneumonia, and septicemia. To help control and treat these symptoms, antibiotics are available to the general public. Antibiotics are a class of drugs that are used to kill or inhibit the growth of bacteria and are classified by their mechanism of action. One of the most common antibiotics used to treat S. aureus are beta-lactam antibiotics. Beta-lactam antibiotics work by binding to penicillin-binding protein, which is used to build the cell wall in bacteria. This hinders cell wall synthesis and damages the cell wall, thus causing the cell to die. However, due to the rise of antibiotic resistance, certain types of beta-lactam drugs, including methicillin, have proven to be useless in the fight against S. aureus. Depending on where the infection is, these antibiotics can be administered topically, orally, or through IV. Methicillin-resistant Staphylococcus aureus, or MRSA, was first discovered in the 1960s, and although methicillin isn't produced anymore due to resistance, the term MRSA still lives on. MRSA is a strain of S. aureus that has developed multiple drug resistance to beta-lactam antibiotics. MRSA is one of the most common resistant bacteria and accounts for up to 74% of S. aureus infections worldwide. Risk factors for MRSA include poor hygiene, being immunocompromised, and invasive medical procedures. To prevent MRSA, practice good hygiene habits, avoid skin-to-skin contact with infected individuals, and ensure they are isolated. Due to the rise of antibiotic resistance, methicillin has been replaced by other beta-lactam antibiotics, including vancomycin, daptomycin, trimethoprim sulfamethoxazole, linezolid, and others. Vancomycin has been the golden drug in treating MRSA infections. However, due to its limitations and increased failure rates, alternative treatments need to be researched. Numerous clinical trials have been carried out to evaluate the efficacy of these alternative antibiotics. A meta-analysis conducted in 2010 compared the efficacy of linezolid versus vancomycin in patients with MRSA infections. Results found that linezolid was more effective than vancomycin in treating MRSA skin infections. Another meta-analysis conducted in 2010 compared the efficacy of daptomycin versus other antibiotics in patients with MRSA skin infection. It was found that daptomycin is equally effective and safe in treating MRSA. However, due to higher cost, daptomycin is often only considered if resistance to vancomycin is suspected. Finally, a retrospective case control study conducted in 2017 compared the efficacy of trimethoprim sulfamethoxazole versus vancomycin for patients with MRSA pneumonia. Results obtained found that trimethoprim sulfamethoxazole was superior than vancomycin in treating MRSA pneumonia. Methicillin-sensitive Staphylococcus aureus, or MSSA, is not resistant to specific antibiotics. First-line treatment for MSSA are beta-lactam antibiotics. 3 meta-analyses were conducted between 2017 and 2018 to compare the efficacy of cefazolin versus beta-lactam antibiotics for patients with MSSA infection. All studies found that cefazolin was superior in treating MSSA infection and should be considered as first-line treatment. Accessibility to MRSA treatment is not difficult, as MRSA is most prevalent in hospitals and the community. However, a big social impact MRSA and MSSA infections have is treatment cost, which can cost up to $3,000 per patient. The biggest contributing factors to these costs are hospitalization and mortality. Psychological impacts include increased anxiety and depression in patients due to isolation, which may even have an impact on recovery. Although our understanding of MRSA and MSSA has improved significantly over the years, there is a need to overcome limitations of current treatments, as well as the growing concern of antibiotic resistance. Investing in research to identify new drugs to treat MRSA will outweigh the economic costs and transform the lives of many around the world.